I perform a lot of hair restoration in African Americans, especially in African American women. And the number one reason that I perform surgery on them is traction alopecia. Now, what does traction alopecia mean? Traction, if you think of the tight braiding that's under tight pulling, and alopecia, a term that just means hair loss. A lot of people use the word alopecia incorrectly. They're talking about alopecia areata, which is a specific type of disease, but all traction hair loss or traction alopecia means hair loss due to over tight braiding. So this occurs very often in African American females due to their hairstyle, and they have this loss across the frontal zone of their scalp. I perform probably one of these every other week, so I perform quite a few of these. I want you to understand that traction alopecia is actually very successful. I can get very, very good outcomes, oftentimes after a single transplant. The one caveat or one restriction I want you to know, despite all my experience in that, is that you may not be a candidate for this transplant. The number one reason you would not be a candidate for this transplant is a condition that mimics traction alopecia, a condition known as either as scarring alopecia or scarring hair loss, which is then subdivided into frontal fibrosing alopecia, or short FFA, or central centrifugal cicatricial alopecia, which is a mouthful, CCCA. What am I talking about? So this is a type of condition that is actually very common in African Americans, and usually it's indicated by loss of eyebrows, loss of the pores so that skin looks shiny, and there may even be some blood vessels you can see. The hair, it looks unusual, it looks all scarred out, it looks flattened out, and sometimes it's actually involving the crown as well. So you think it's just a bald pattern in the back. In the old days, it was known as hot comb alopecia, that because people thought it was due to styling results, but it really isn't. It's just a very unusual condition. So if there's any suspicion of burning, itching, loss of all the quality of skin, and there's a progression of that disease, that's known as a trichologic emergency, which means you need to go see your doctor for a biopsy and treatment so it doesn't get worse, because once it gets worse, it really has an issue with not being able to be fixed, and I can't transplant it. So what does traction alopecia look like? Now, sometimes there's an overlap where there's actually both conditions, or there's a suspicion. Where there's a suspicion, I say go to the dermatologist and get a biopsy. But traction alopecia, the history is usually different. I had tight braids 10 years ago. I lost all that hair afterwards, and it hasn't progressed, it hasn't changed. My eyebrows look normal, unless it's been overplucked. And everything has been pretty much the same for 5 years, minus maybe a little thinning from female pattern loss. Usually there is what's called a fringe sign, a ghost sign, which means that the anterior portion of the very, very anterior border, there's a ghost of a fringe of hair still there. And so that is usually indicating those are things that push me to, okay, you most likely have traction alopecia, let's go with surgery. Again, if it's progressive, burning, itching, loss of hair around the area, involvement of the crown, that would push me to get a biopsy beforehand. So if you fall in that latter category, before you schedule a consult with me, get a biopsy from a dermatologist showing that it's not active, it's not scarring alopecia, then I'm more inclined to do something. If you're falling into the former category, which is just the fact that there's a fringe sign, it's burned, it's something you had many years ago, it's not progressing, that's usually traction alopecia. I feel more inclined to go ahead and start with a consult and move you forward with possible surgery. So for African American females, the other question I always ask is, do you have a history of keloids? And keloids is something I also specialize in. But a keloid, a lot of people think it's a keloid when it really isn't. So what I'm talking about is a big, like football size, or not football, but like a ping pong size ball somewhere hanging off your earlobes if you've had that. That usually indicates I cannot do my traditional incisional based surgery. Now, the reason why I prefer an incision based on females is a lot of reasons. First of all, the sweet spot, the highest density grafts are in the center and the back. When I do FUE, I'm harvesting a very wide zone that's not as healthy. The second problem, it over thins out the back side, so it becomes much shallower and thinner, and women hate that. And so by taking a very narrow 1 centimeter incision on the back side, I'm able to harvest those hairs in a way that doesn't cause the back side to be overly thin. So that's a big passion of mine. The other big reason is you don't need to shave the scalp. And so with FUE, you have to shave that back side, which is a negative. With a small strip procedure, when you leave my office, you're not going to be able to see that there's an incision there, and the sutures come out in a couple of weeks. It's the day of the procedure is incredibly easy. There's not much pain at all. In fact, because we have a fully Joint Commission accredited facility, there isn't pain. It's so different from everywhere else. And it really is unique, the fact that I specialize in dealing with African American females, and I've got so many before and afters on my website. I do one, I said, almost every other week, sometimes every week. And the reason why it's so important, it's not just what I do as a surgeon in terms of design and handling and harvesting, but my staff who dissect those grafts, because the hairs oftentimes are what they call the hard curl. It's total C shape. They're very hard to dissect, but my staff is able to do this every week to every other week, and they're so trained at doing this. They're able to place those grafts really with ease. So, and I also do a ton of female hairline design. I just did one yesterday. I do a beautiful design, and the design is different for females versus men. So a lot of times places are only doing FUE or they're only doing men, and I do everything from FUE, strip. And really I tailor it to you, but the biggest thing is I specialize in African American females. I encourage you to just watch the general video on female hair loss virtual consultation. I'm not going to go through all those details. I just wanted to cover sort of the salient points or the major points about traction alopecia and how I do it and why it's so important in terms of getting a result, and the fact that I have very, very high success rates and experience with this disease process.